Have you ever felt a little off? Maybe a new ache or an unusual tiredness, and just shrugged it off, telling yourself, "Oh, it's just part of getting older." It's a common thing we all do as we journey through our 60s and beyond. We tend to attribute so many little changes to the natural process of aging. And in many cases, that's true. But what if some of those seemingly minor shifts, those strange new sensations, are actually your body trying to tell you something really important? What if they're whispers from your heart, signaling that it needs a little extra attention? It's a painful reality that many heart issues in later life often don't announce themselves with a sudden, dramatic chest pain like you see in movies. Instead, they can show up in much more subtle, even puzzling ways, making them easy to miss or dismiss. And missing these signs can have serious consequences. But there's a secret, a quiet understanding, that can empower you. Knowing what these less obvious symptoms are means you can listen to your body more closely and get the help you need sooner. In this video, we're going to gently explore 6 strange symptoms that might reveal your heart is in trouble after 60. These aren't the ones everyone talks about, but they're incredibly important for you to recognize. So, settle in, relax, and watch to the very end, because there's something truly surprising waiting for you that could make all the difference. Let's dive right into the first of these signals that your heart might be sending you. And it's something many people notice but rarely connect to their heart: unexplained swelling in your legs, ankles, or feet. Now, I know what you might be thinking. My feet swell up when I've been on them all day. Or, I've always had a bit of swelling. It's just my circulation. And yes, minor swelling can be very normal, especially after a long day, a lot of standing, or during hot weather. But we're talking about a different kind of swelling here, one that feels persistent, seems to come and go without clear reason, or just gets worse over time. Imagine this: you wake up in the morning, and usually, your ankles look pretty normal. But lately, you've noticed they're already a bit puffy, and by the end of the day, your socks are leaving deep indentations, or your shoes feel uncomfortably tight, even if you haven't been particularly active. When you press on the swollen area with your finger, does it leave an indentation, almost like a little dimple? That takes a few seconds to fill back in. This is often called pitting edema. And while it can be caused by various things, like kidney issues or certain medications, it's a classic sign that your heart might not be pumping as effectively as it should. When your heart struggles, it can't push blood through your body with enough force, causing fluid to back up and accumulate in the lower parts of your body. Where gravity pulls it, it's like a tired pump struggling to keep the water flowing. For example, consider Margaret, a lovely woman in her early 70s. She'd always been active, enjoyed her gardening. But over a few months, she started noticing her garden clogs felt tighter and tighter, and her ankles seemed permanently puffy. Her family just said, "Oh, it's the heat," or "You're on your feet too much." But the swelling became more pronounced. Her legs felt heavy, and she started feeling a bit breathless when she walked across her garden. When she finally mentioned it to her doctor, who looked beyond the "just getting old" assumption, they discovered her heart was indeed struggling, and the swelling was a key indicator of early heart failure. The good news is, once they understood the cause, they could start treatments that helped manage the fluid and support her heart. So, if you're seeing persistent, unexplained swelling, particularly if it's new or worsening, and especially if it's accompanied by shortness of breath, please don't just dismiss it. It's a whisper from your heart, asking for attention. Now, let's move on to our second strange symptom, one that's often misdiagnosed as allergies, asthma, or even just a lingering cold, a persistent cough or wheezing that just doesn't seem to go away. Most of us get coughs from time to time, especially during flu season or if we catch a cold. And sometimes, they linger for a few weeks. But this is different. We're talking about a cough that sticks around for months, or seems to get worse when you lie down, or might even produce a pink-tinged or frothy sputum. It's often described as a hacking cough or a dry, irritating cough, and it can be accompanied by a wheezing sound, like your lungs are struggling to get enough air. Why would a heart problem cause a cough? It all goes back to that fluid buildup we just talked about. If your heart isn't pumping efficiently, fluid can back up not just into your legs, but also into your lungs. This is called pulmonary edema, and it's like having a persistent dampness or congestion in your lungs. Your body's natural response to fluid in the lungs is to try and cough it out, leading to this nagging cough. It's your lungs trying to clear themselves. But the problem isn't in your lungs directly. It's in the heart that's failing to pump effectively. Think about John, a retired school teacher who loved reading in bed every night. For months, he developed this irritating cough that would get really bad as soon as he lay down. He tried all sorts of cough syrups, thought it was his allergies acting up, even got tested for asthma. But nothing seemed to help. He felt increasingly tired and breathless. But again, blamed it on his age and the persistent cough. It was only when his wife noticed he was also sleeping propped up on several pillows to breathe easier, and his feet were a bit swollen, that they finally went to a cardiologist. They discovered his heart was severely weakened, and the cough was a direct result of fluid accumulating in his lungs when he lay flat. Once his heart condition was diagnosed and treated, the cough miraculously disappeared. It's a powerful reminder that sometimes, what seems like a simple respiratory issue can actually be a sign from your heart. So, if you find yourself with a cough that just won't quit, especially if it gets worse when you lie down, or if you notice any unusual fluid, please mention it to your doctor and specifically ask them to consider your heart as a possible cause. Your heart communicates in subtle ways, and sometimes, a persistent cough is one of its most urgent calls. This takes us smoothly into our next critical symptom, one that affects so many aspects of daily life. Moving on, let's talk about a symptom that nearly everyone experiences from time to time. But when it's extreme and persistent, it can be a significant red flag from your heart, that crushing, almost unshakable fatigue or weakness that goes beyond a bad night's sleep or a busy day. Now, it's completely natural to feel tired as you get older, especially after physical activity or a full day of engagements. But we're discussing a profound, pervasive sense of exhaustion that limits your ability to do even simple, everyday tasks you once took for granted. Imagine waking up in the morning feeling as if you haven't slept at all. Even after 8 hours, you feel drained, heavy, and even lifting a teacup feels like a monumental effort. This isn't just being a bit tired. It's a deep-seated weariness that no amount of rest seems to fix. Why would heart trouble cause this kind of debilitating fatigue? It's quite straightforward. Your heart is responsible for pumping oxygen-rich blood and nutrients to every cell in your body, providing the fuel you need for energy. If your heart isn't pumping efficiently, your vital organs and muscles aren't receiving enough blood, and consequently, not enough oxygen. This lack of oxygen and nutrients leaves your body constantly running on empty, leading to that overwhelming sense of fatigue and weakness. Think of it like a car trying to run on fumes. It might move, but it's sluggish, inefficient, and eventually, it'll sputter to a halt. Sarah, a vibrant woman in her late 60s, loved walking her dog every morning, slowly. Over several months, she found herself dreading the walk. She was so exhausted. She could barely manage a short stroll around the block, and even getting dressed in the morning felt like running a marathon. She blamed it on the winter blues, then maybe anemia. But no blood tests showed anything definitive. Her doctor finally sent her for a heart checkup, and they discovered her heart was struggling to keep up with the demands of her body. Once her heart condition was diagnosed and treated, she slowly but surely started to regain her energy, and her morning walks with her dog became a joy again. This kind of fatigue isn't just about feeling sleepy. It's a profound inability to perform even the most basic activities due to sheer lack of energy. and it's a vital sign that your heart might be working harder than it should. That leads us directly to our fourth subtle symptom, one that can be quite frightening when it happens: sudden dizziness or feeling lightheaded, almost like the room is swaying or spinning. Again, occasional dizziness can be a result of many things: standing up too quickly, dehydration, or even inner ear problems. But we're talking about recurrent episodes of lightheadedness or feeling like you might pass out, especially if they occur without a clear reason or are associated with physical exertion. Imagine you're just sitting there, perhaps watching television, and suddenly, the room seems to tilt, or you feel a wave of faintness wash over you. Or maybe you're walking across a room, and you momentarily feel like you're going to lose your balance. These sensations can range from a mild unsteadiness to a full-blown feeling of nearly blacking out. What's the connection to your heart? Dizziness or lightheadedness often occurs when your brain isn't receiving enough blood flow, which means it's not getting enough oxygen. If your heart is struggling to pump blood effectively, or if you have an irregular heartbeat and arrhythmia, the blood supply to your brain can be momentarily interrupted or reduced. This can lead to that dizzy or lightheaded sensation. Sometimes, it's your heart beating too slowly, too fast, or irregularly, causing erratic blood flow. Consider Robert, an avid golfer in his early 70s. He'd started to notice these strange moments on the golf course where he'd suddenly feel lightheaded, almost like he needed to sit down immediately. He attributed it to the heat or perhaps not eating enough. But these episodes became more frequent, sometimes even happening when he was just walking slowly. One day, he nearly fainted after hitting a golf ball. This prompted him to see his doctor, who discovered he had an underlying heart rhythm problem that was intermittently affecting the blood flow to his brain. With the right diagnosis and management, Robert was able to get back on the golf course, feeling much more stable and secure. So, if you're experiencing repeated, unexplained episodes of dizziness, lightheadedness, or feeling like you might faint, it's a symptom that absolutely warrants immediate medical attention. It could be your heart subtly telling you it needs a closer look, ensuring your brain gets the steady blood supply it needs to keep you balanced and well. Next, we uncover a symptom that most people would never connect to their heart, yet it's a crucial one to understand. Let's talk about the fifth symptom, and this one often catches people completely by surprise because it seems so unrelated to the heart: a strange loss of appetite, or persistent nausea and digestive upset that feels like more than just indigestion. When we think of heart problems, our minds usually go straight to chest pain or shortness of breath, not to our stomach. But a struggling heart can indeed affect your digestive system in unexpected ways. Imagine finding that your favorite foods just don't appeal to you anymore, or you feel full after only a few bites. Even if you haven't eaten much, you might also experience a persistent queasy feeling, nausea, or general stomach discomfort, like a constant dull ache or bloating that doesn't respond to typical antacids or dietary changes. Why would your heart cause these digestive issues when your heart isn't pumping blood effectively? Fluid can back up, not just into your lungs and legs, but also into your liver and digestive tract. This congestion can lead to swelling in the liver and intestines, which interferes with digestion and can make you feel full very quickly, cause nausea, or simply make food unappetizing. It's like a traffic jam in your abdomen, making everything feel sluggish and uncomfortable. Your body's natural response to this internal congestion is often to lose interest in food because your digestive system isn't working properly, and it can even trigger persistent nausea. Consider Edna, a wonderful woman in her late 70s who had always loved her food. Her family started noticing she was eating less and less, complaining of feeling full almost immediately, and often felt nauseous, especially after meals. She lost a noticeable amount of weight, and everyone just thought it was stress, or maybe a touch of stomach flu that wouldn't go away. After months of this, and feeling increasingly weak, her doctor ran a series of tests and discovered her heart was weakening, causing fluid to back up into her abdominal organs. Once her heart condition was diagnosed and treatment began, her appetite slowly returned, and the nausea subsided. This shows just how interconnected our body systems are, and how a problem in one area, like the heart, can manifest in seemingly unrelated ways, like persistent stomach issues. Finally, we arrive at our sixth strange symptom, one that many people are aware of in its classic form, but might miss in its more unusual presentations: discomfort or a dull ache in your jaw, back, or even your right arm or neck. Most people know that a heart attack can cause pain in the chest that radiates down the left arm. But what many don't realize is that heart-related discomfort can show up in a variety of other places, often as a vague pressure, tightness, or a dull ache rather than sharp pain, and it can affect women and men differently. Imagine feeling a persistent, nagging discomfort in your jaw, almost like a toothache. But it's not localized to one tooth, and your dentist can't find anything wrong. Or perhaps you experience a dull, persistent ache in your upper back, between your shoulder blades, or even radiating into your right arm or shoulder. That doesn't seem to be relieved by stretching or changing positions. It's not necessarily a sharp, stabbing pain. It might just be a general feeling of unease, pressure, or fullness. Why would heart trouble cause pain in these distant areas? The nerves that carry pain signals from your heart also send signals to other parts of your body, particularly areas like your jaw, neck, back, and arms. When your heart is under stress or not getting enough oxygen, these nerve signals can get confused, and your brain interprets the pain as coming from these other body parts, rather than directly from your chest. This is known as referred pain. For example, David, a seemingly healthy man in his mid-60s, started complaining of a persistent, dull ache in his right arm and shoulder that he thought was a pulled muscle from gardening. He also had a vague, unsettling pressure in his jaw that he attributed to stress. He saw a chiropractor for his shoulder and a dentist for his jaw, but neither could offer lasting relief. It wasn't until he felt a slight breathlessness after a short walk that his wife urged him to see his general practitioner. Tests revealed significant blockages in his coronary arteries, and his muscle ache and jaw pain were actually referred pain from his struggling heart. Once his heart condition was addressed, those strange pains disappeared. This highlights the importance of recognizing these less common, yet equally critical, signals from your heart. So, there you have it. 6 strange symptoms that might be your heart asking for attention. From unexplained swelling in your legs and persistent coughs, to overwhelming fatigue, sudden dizziness, a puzzling loss of appetite, and even unusual aches in your jaw or back. It's crucial to remember that while each of these symptoms can have many causes, when they are persistent, new, or appear together, they are whispers that you should absolutely listen to. Your body is an incredible system, and it has a way of communicating when something isn't quite right. Don't dismiss these signs as simply getting older. Instead, let them empower you to be proactive about your health. The most important takeaway here is not to diagnose yourself, but to be aware and to have open, honest conversations with your doctor. Be your own advocate. Describe exactly what you're experiencing, how long it's been going on, and how it impacts your daily life. Remember, small changes, when recognized early, can make a huge difference to your heart health and overall well-being. It's all about catching things early and giving your heart the support it needs to keep ticking strong. We've talked about these important signs, and now I have that something surprising for you that I mentioned earlier. It's this: many people believe that after a certain age, say 60 or 70, your heart's fate is sealed by genetics and past lifestyle choices. The surprising truth is, your heart has an incredible capacity for healing and improvement. Even in later life, with the right care and attention, it's never too late to make positive changes that can significantly impact your heart health and quality of life. Whether it's starting a gentle walking routine, making small shifts in your diet, or simply being more mindful of these subtle symptoms, your heart can respond positively. You truly have more power than you might realize. So, take these symptoms as a guide, not a cause for fear, but as valuable information to help you live your fullest, healthiest life. What has been your experience with any of these symptoms? Or perhaps you have a story about a symptom you initially dismissed that turned out to be important. We learn so much from each other. So please, share your thoughts and experiences in the comments below. Your insights could help someone else who's feeling the same way. If you found this video helpful and reassuring, give it a thumbs up and share it with someone you care about who might benefit from this information. And for more helpful content designed to empower you to live your best life at every age, make sure you subscribe to our channel and hit that notification bell so you don't miss a thing. Remember, every day is an opportunity to make choices that support your well-being. Live your best life at every age.